Hi, everyone. Welcome to today's session, Reimagining Healthcare Journey, AI Solutions for Patients to Providers. And trust me, it's a conversation worth having. We're diving into how AI is transforming healthcare from every angle, helping patients get more personalized care, making things more efficient for providers, and even leveling up pharmacy engagement. From smarter scheduling and care plans to improving medication follow up and proactive outreach, AI is making the healthcare experience more connected and more human. We've got some great insights to share today, real world examples, actionable strategies, and a look at what's coming next as clinical and pharmacy priorities come together in new, meaningful ways. So, whether you work in care delivery, tech, pharmacy, or you're just curious about where healthcare is headed, you're in the right place. If you don't have the chat or comment area opened up, please go ahead and do so now. Just look down below if you're on your phone or to the right-hand side of your screen if you're on a desktop for an area to leave your comments. This is where we'll be asking you questions and feedback. We want it to be a two-way street where it's truly interactive during the time we spend together and during this session. Please feel free to share any ideas or questions that may pop up as we go through this session. In fact, let us know right now where you are joining us from. And as you all are sharing with us, I would like to introduce myself very quickly. My name is Monique, and I'm your host, and I'm here today on behalf of Pronix Inc. At Pronix, we partner with healthcare providers and pharmacies to help them transform the way they engage with patients using the power of AI and automation. Whether it's virtual health assistants that actually feel helpful, smarter appointment scheduling, reminders that patients actually respond to, or making sure people stick to their medication plans, we build solutions that connect all of the dots. And we make sure everything works smoothly with your existing systems, EHRs, pharmacy platforms, telehealth tools, you name it. At the end of the day, our goal is to help organizations deliver care that's not just smarter, but also safer and more connected. Because when that happens, everyone wins patients, providers, and the whole system. Now, before we dive in, I'm excited to introduce the incredible experts joining us for today. First up, we have Garika. Garika, welcome. How are you?
Thank you, Monique. I'm good. Hi, everyone. I'm Gorika, and I'm the Global Marketing Manager for Digital and AI at MedAdvisor Solutions. I specialize in driving AI powered marketing strategies as well as digital transformation across healthcare, with a major focus on creating smarter, more personalized engagement experiences. At MedAdvisor Solutions, we're focused right now on enabling pharmacy led patient engagement using AI and automation to reach patients more precisely, improving adherence, and ultimately supporting healthcare teams in delivering timely, meaningful care. I'm very excited to be here today as part of this panel with Vinod and Gary, and I'm happy to see and share where we're going across the industry today.
All right, thank you so much, Garika. Next, we have Vinod. Vinod, welcome, my friend. How are you? And tell us a little bit about yourself.
Yeah, thank you, Monique. Thank you for having me. It's great to be here. My name is Vinod Subramanian. I'm the Chief Operating and AI Officer at MedAdvisor. It's exciting to share a stage with you, Gary and Gaurika, folks with a lot of insight, right, in the industry. We at MedAdvisor focus on pharmacy-driven, hyper-personalized patient engagement. But I think the heart of all that is serving patients in a way where the tools can enable them in their medication journey. While the topic is AI, the focus has always been about the human experience in elevating that. And in some cases, it happens to be AI, right? That is enabling us to do. Technology is always an enabler, right? It's not the core. The core is how do we enable the patient care. So the topic that we have today and some of the things we're going to be talking about in terms of insights, it's going to be great, right? In terms of driving the dialogue more in the industry and overall elevating it.
Thank you so much, Vinod. And then last but not the very least, we have Gary. Gary, welcome. Please tell
Thank
us a
you.
little bit about yourself, please.
Sure. I'm Gary. I manage the healthcare practice here at Core. Been here for a long time, been in the healthcare industry for 30 plus years. I focus on product and strategy across three segments: healthcare payers, providers, and life science. At Core, we're focused on enterprise AI offerings, and we position them as AI for work, AI for process, and AI for service, which we'll talk more about as we go. Pleasure to be here. We seldom get a chance to talk about things we're doing. We're more focused on doing. So it's great to be with my colleagues here.
Thank you so much. Thank you, Gary, and thank you all for being here. To kick things off, let's start with something that's been generating a lot of buzz, the rapid evolution of chatbots, generative AI, agentic systems, and LLMs, also known as large language models. These technologies are changing fast, and while they're not the main focus of today's conversation, they're shaping the foundation of what's possible in healthcare, from how we automate interactions to how we think about intelligence at scale. So we'll spend just a few minutes unpacking how this AI convergence is setting the stage, and then we'll dive into what we're really here to talk about, which is reimagining healthcare journeys with AI. So let's get into it. And Gary, I would love to start with you first.
Sure, thank you. So I think you've touched upon the convergence in a nice way, right? I mean, for us, for everybody on this call and likely in our audience, we like to focus on the patient first. There's some buzzwords. We know we always have to do more with less in healthcare. And this has really been a trend in a set of technologies that have evolved in a very positive way in healthcare. Unlike a lot of healthcare tech, we're typically 10, 11 years behind. But in the case of AI or conversational AI or generative AI and now agentic AI, I feel like healthcare is really in the forefront. We've gone from clinical decision support, right, where we were doing some computational, machine learning and deep learning in healthcare for a long time. And we're moving in a really nice way towards these agentic models. Yes, we've been doing this, for example, for at least at Core for 11 years, where we focused on like AI for service, which was what I refer to as the low-hanging fruit, right? Patient satisfaction, patient self-service, those types of things, which we'll talk about more. But I feel like we're really in a great position to take advantage of this convergence and move into the more of the autonomous agents and some of the cutting-edge agent network things that we're going to see in the future. So great opportunities, a great time to be in this space, which is not something we would typically say in health tech.
Most definitely. Garika, Vernon, is there anything you'd like to add?
Yeah, I think the one interesting point that Gary made, right, is it's a great time to be in healthcare as actually a subscriber to the care, right? Because see, the point that and Gary also mentioned, right, is trying to do more with less. See, I think AI today enables us to do that as a technology, because in the past you needed an army of people and budget and approval and appropriate regulation to get anything done, and you're talking about 3-4 years. By then, right, the person who needs the care is long gone, and the need is also long gone, right? But today, right, we can take something with appropriate governance and regulation in a span of weeks, and that is quite powerful. And especially in healthcare, where there is affordability, equity that is needed, more importantly, access to care at the right time, in the right form for the individual when they need it on demand is rising. And with inflation right now, it enables us an opportunity for the first time in a very long time to translate that from talk to action, right? It's an impactful action. I think that is what I think Gary is talking about. And I think we all feel it, right? Because again, the reason why we're talking about this today, Monique, is the fact that everybody is excited about it. There is more to be done. We need proof points. But I think everybody acknowledges that this is an amazing time to be around, right? And in leveraging technology to get meaningful outcomes, right? In a thoughtful way.
Thank you so much. In fact, I want to just quickly pose this, since Gary, you said this and Vinod, you agreed. Gary, you said how like healthcare, normally it's behind or considered behind or more antiquated, if you will. But now it seems like the healthcare industry is in the forefront. Why do you think that is?
I think, thank you for asking that. I do think it is because of the transformers, right? These models, these large language models have really brought us from, down this path from artificial intelligence, machine learning, right, to deep learning and now generative. But these models have enabled us to accelerate, right? So I think in healthcare today, and I do collaborate with a lot of clinical leaders, they position it as though if you're not using some of these tools, you're exposing yourself to a legal exposure. And that's a weird thing to say, right? Because we're not replacing the human, we're augmenting the human, right?
Right.
So, second opinions, especially in radiology, right? Where, these technologies are, rock solid. There's over 1,000 tools available today in the clinical setting that caregivers can, leverage. So anyways, I do think the reason why is because we recognize that there's just not enough humans to provide the type of care at a reasonable cost to our patients. Now, it is different globally, but we don't have time to maybe go into that part of the discussion.
Right.
But I think it's the enablers. If you short answer, it's been these enablers, these transformers, if you will. Yeah.
All right. Thank you. Thank you for sharing that. Now that we've touched on where, AI is heading at a foundational level with the chatbots, generative AI, and agentic AI, it's time to really zoom in on what really matters today. And these type of things are, how are these technologies showing up across the actual healthcare journey from the moment a patient, let's say, schedules an appointment to how providers manage care and how pharmacies support follow through. AI is already playing a role. But what's working, what's not, and what are the biggest opportunities right now? So, to get us started, I love to bring all of us, including the panel, into the conversation. Garika, we're going to kick off this first question to you. How is AI transforming patient experiences by delivering personalized care across clinical and pharmacy settings?
Yeah, that's a really good question, Monique. I think as Gary and Vinod set the stage about having different tools and being able to really augment humans along with AI tools, it's also really changing how patients experience healthcare today by making it more personalized and proactive for them. I think I'd say in clinical settings, that could mean using AI to build more tailored treatment plans based on a patient's medical history or even their risk profile, which is like a really, really key thing for each of the patients. However, on the pharmacy side, I think it's helping identify when someone's likely to miss a refill or benefit from a particular reminder about their medication that they're on right now. And then being able to nudge them at the right time with the right message in that right format.
Mm-hmm.
That has AI has made that really easy and fast to implement. Even at MedAdvisor Solutions, we're trying to do the exact same thing, like helping pharmacies reach patients more precisely with personalized education, reminders, and support programs, whether it's a chronic condition or be it a seasonal vaccine. I think we all of us want to make sure that we're focused on making every interaction of a patient with their healthcare provider more relevant, more timely, and honestly more effective at each of those stages that they're in.
Thank you so much for sharing, Garika. Our next question is for you, Gary. In what ways is AI helping reduce administrative burdens in healthcare and pharmacy operations?
So many ways. I like to refer to it as if we could just, walk, run, crawl, the walk is really well established in the market, right? The ability to manage the low-hanging fruit, the high volume transactions that are occurring in healthcare that would enable things like our contact center agents or our case managers to focus on more complex cases. So for example, patient-facing automation, scheduling an appointment, changing an appointment, cancel an appointment. What's my lab results? Who's on my care team? What is this? What are the indications here? If you move into the payer space, I need my ID, my member ID. I'm mom, I'm walking into the doctor's office. I need my card, right? What are my benefits? How much is this going to cost me? And if you go into the life science space, it's some things as simple as medical affairs. A caregiver calling up for the adverse events or a patient calling up, right? What are the indications? How do I take this medicine? What's the dosage? So in all those segments, I like to think of them, I break them down into really, as we do at CORE, into work, process, and service. The service piece is the low-hanging fruit. Take that away from the human agent, allow them to do more effective, business processes. These technologies are, we have customers that are managing 300 million phone calls for some of these things a year, right? Imagine the savings that these organizations are, saving, because, and imagine the patient and the satisfaction level to get an answer quick instead of waiting on hold for 20 minutes, 45 minutes, right? So that's what I think is the kind of the simple things. Where it gets more complicated, briefly, is in AI for process and some of the things that we might do around agentic applications where there's processes that can run in the background to actually generate results. And we'll talk more about that as we go. But the low-hanging fruit automation is absolutely critical at this point. We need to do more with less. We need to take a call from costing us $15 to schedule an appointment down to, I don't know, 50 cents, right? Our industry cannot survive the way we are today.
Yeah, I totally agree. In fact, I just feel like, even with the pandemic, I feel like there's been a backup. People have been falling behind on their checkups or just, so many different things. And I just feel like a lot of times, even just right now, it's hard to get an appointment or you're on hold for the longest just to get a simple checkup or a physical. So I definitely see there's a huge need and slash potential demand for something like this. And I totally agree with you as far as like service is definitely the lowest hanging fruit. Vinod, is there something you wanted to add? I saw that you unmuted yourself, so I just wanted to make sure if there was anything
Yeah, I
you wanted
think,
to add.
I think there are a couple of things, right? Even the previous question that you asked, Gaurika, and to Gary, I think there are so many unmet needs, right? Specifically in terms of the administrative overhead. It's quite easily solved because, especially in healthcare, it is not just about solution, right? It's about patient safety and patient privacy and making sure that they can get to that end outcome in a clean way that elevates their experience. So if you look at it from that lens, the administrative overhead is it's been proven, right, that you need human in the middle. I want to schedule an appointment. I need to pick up my medication. I need to do a refill, and I need to get an appointment with a specialist. I have a question, right? It's 8 o'clock in the night, and I need to take a medication. I missed it. I should have taken at 7. And
Right.
or I have multiple medications, and which one do I take? I forgot. Or you're a caregiver, right? And you have something you totally forgot because life takes over, right? And we have to do multiple things. We take care of our kids, we take care of our parents, we support our friends and family. In that journey, you need tools which are on demand, right? So you have to think about all that in a way where how do you give it in a snackable size, right? In a way where people can actually take advantage of it. From that lens, Monique, right? I think the point that Gary mentioned, right? It is right? The administrative aspects of tasks that happens whether in the provider space, payer space, pharmacy space, right? It's well proven, right? And there's enough and more in their mix. The other piece, right, is see there needs to be trust that needs to be built, right? Because see, you and I, along with the Gary and Gorika, are recipients of healthcare in many ways, right? Whether we go to our pharmacy or to the doctor or deal with insurance. But I think if you don't have trust, right, you're not going to use technology. And there is an inherent lack of trust when it comes to technology. And I think that is first and foremost that we all need to address, right? Because while there are regulations, especially when it comes to AI, there is no one set of standards that everybody follows. It's still evolving. So when it comes to patients, they have to look at it and say, how do I trust this, right? Is there an ISO certification that basically says this is ISO certified or this is compliant with so and so HIPAA, right? You have many of that. I think we have to build the trust. Once the trust is built, it automatically enables people to change and adopt technology. So that way it reduces the price, it reduces the way it takes time to get something, and it can be done in a way where it elevates their experience. Again, coming back to that experience piece, right? You have to look at it to say, what experience are you improving? And is the tech enabling you to do that? Then keep doing it. Beyond the administrative overhead, there are other things, right, that we are going to touch upon today, as you mentioned, telehealth, getting the right support, right, for the individual, whether it's medication and whether it's simple things as ordering or even looking up for questions, right? To say, can I have grapefruit with my medication? Probably not, right? But how do I get that information quickly without having to call somebody, right? So all that is something that today technology is significantly elevated, right, and improved, right, in that journey.
Thank you for sharing, Vinod. You definitely brought up a good point about like trust in technology, and what brought up to mind. And please, people, do not come at me, but with baby boomers or older people not necessarily being as technologically adept, and having to be shown how to do certain things. Um, and then now there's this AI, and then you know the stuff that's going on in media and what they're putting out there. So I definitely appreciate you bringing up the whole trust issue, because there is a trust issue, and I think it's being done generationally too. So I think those are just some major hurdles that we have to slowly work at, and hopefully can overcome. Vinod, our next question is to you. It's actually a great segue to what you just said, as far as like providing examples of support and things like that. How is AI improving patient scheduling, reminders, and appointment adherence?
Yeah, today I think that's one area, right, that significant work has gone research, development, and improvements in that administrative piece of it, right? Because it's not everything. Let's just use it as an example, right? I have to go to a doctor, and when I get to the doctor's office, there are a whole bunch of questions I need to answer, and then I interact with the doctor or the nurse practitioner. At that point, the doctor basically says, "Okay, great, need to order a medication," or there's a follow-up. Now, when I get out of the office, I need to either go to the front desk and schedule, or I need to pick up the phone and call. If I'm using an app, I can try to go look at the schedule and do that. But if you think about it, it's not integrated. Now, what is happening, right? If you think about the use cases, when I go to the front desk, they already know that I've come for a certain condition and I'm meeting so and so doctor. It automatically creates a snackable size, a bit size for the doctor to basically make sure that he understands or she understands that I'm there for a certain thing, right? The summary is there. When I finish up meeting with my doctor, even before I get out of the office, my follow up is already scheduled because it's already there, right? The data and the details and all in the same system. It's easy for them to schedule that. And AI today can stitch that to say, I'm going to this pharmacy, I'm seeing this doctor, my next appointment should be in 2 weeks. What is the available appointment? Give me options. It's a simple question the doctor asks me, click, done. Right? So that scheduling can be expanded to any number of ways, right? Whether it's going to a pharmacy to get a vaccine, or going to pick up my medication, or a follow-up to a doctor. Now, the other piece, right, that comes that it doesn't quite visible for everyone is sometimes I need to get approval from my insurance, right? Some of them are pre-approved, some of them are not. And today, right, it takes time, right? It's not as easy as just picking up the phone and talking to somebody and some. With AI, since the data again is there, right? The journey is the patient's journey. It's easy for us to look at what has been prescribed, what is the follow-up needed, where do we need to have specific approval versus pre-approval, and that is another area where there's significant work that is going on, right? And then the last piece, right, is see if you think about it, somebody is getting medication. We are assuming that the person is taking medication. What if they're not taking medication? Because the point where the entire system stops is when the person goes and picks up the medication. At that point, the assumption is made that the person is making medication, and we are validating that assumption when somebody goes and does a refill. So there is a gap in between, right? And how can technology enable the individual to make sure that they're continuously taking and they know that they're taking medication? Because as we know, the last mile for healthcare improvement is the medication management and taking the medication at the right time as prescribed. And that's another area where I think tools, right? Smart tools, simple tools that is part of our ecosystem because we are all used to smartphones. The app is there, integrating that and then powered by AI makes it quite easy, right? And the other important piece, right? Interesting thing, I use an app. One of the things that I'm finding more and more is sometimes, right, when I'm in the app, my phone knows what I'm doing when, right? Whether I'm going to LinkedIn or I'm going and reading the news at a certain time. After a point, there's a pattern formed. And when the pattern is formed, right, the system can automatically say you're doing certain things at a certain time and start reminding you to say, by the way, for the past 2 months you were doing this. Do you still want to do it? Or your time to take medication, just a reminder. Those simple things go a long way, right? Because those small things are the one that makes a big difference, right? Not big things. And today, right, I think technology is enabling us to do that.
Thank you so much, Vinod. Garika, I would like to open this up to you in case if there was anything you would like to add.
Yeah, so I think as Vinod mentioned, AI is definitely making patient follow-ups much more effective by understanding when and how to reach someone based on their past behavior. I think one of the really key points that I'd like to add is um, instead of sending the same reminders or messages to everyone, what AI can do is really figure out the best time and channel for a particular person to send that nudge, whether that's a text, an email, or an app notification based on the type of content that they consume. So to be able to reach them in that particular context, I think that very simple shift can make a huge difference in whether or someone actually follows through that appointment or a reminder and makes that happen. So being able to like really seamlessly integrate into their behavioral patterns is what's going to set it apart from what we're doing now.
Thank you. Yeah. I just want to say the whole idea of patterns, behavior, it's always amusing to me. Like you mentioned, Vinod, if my phone says, "Are you heading home or a certain destination?" And I'm like, wait a sec, I didn't even tell the GPS or, how did it know? So I just want to say thank you so much for bringing that up. Or if, like Alexa, because I have one
Yeah,
nearby,
don't say
says
that
something
name.
like,
Right.
do you want that or this reminder? And I'm like, yeah. So they're I just want to say thank you for bringing up the whole idea of keeping track of our behaviors and our patterns more specifically. Gary,
So
oh, Gary, is there something you wanted to add or?
yeah, I think it's
Yeah.
super interesting. So when you touched upon a lot of AI for service, right? Where it's mem like patient self-service, some automation. Garka, you focused on some service, right? Some agents that are running in the background for reminders that don't require, again, a human. We're also finding a huge demand in the provider and payer space around supporting the contact center agent with AI and providing them with these same capabilities. So while we'd love to automate a lot for patients, given that it's healthcare, there are a lot of patients, whether it's demographics or what have you, that where they just want to speak to a human, right? And that's okay because that's what we're here for. We're providing patient care, and we still are more empathetic than a virtual assistant in in many cases. So being able to identify that and getting them to a human live agent is super important. And what we found is that if we can provide these same tools, which we do, to our contact center agents, where the automation is listening into the call or watching the chat and automating those tasks for the agents, you're significantly reducing the burden, you're improving the HIPAA, you're improving compliance, you're reducing the training in a contact center environment, and you're providing, like automated summarizations of the call so they don't have to type up the entire summarization themselves, or you're providing them with the next best action. All of those capabilities, big opportunity in healthcare, especially again, given that people like to talk to people at times. Yeah. I
Most
mean,
definitely. Yeah, no, thank you for bringing that to our attention, and yes, very much so. Gary, so how is AI bridging gaps between siloed healthcare systems, including improved collaboration between pharmacies, providers, and patients?
so I'll stick to my theme of work, process, and service because that's what I'm to do. And at the work level, right, it's providing caregivers access to information in a unified way across multiple platforms, whether that's the EMR or practice management system or CRM, right? Allowing a caregiver to inquire and get results using highly complex RAG capabilities, advanced RAG capabilities, agentic agents, what have you. The technology is really well suited to summarize a patient's notes. We all know the use of patient around ambient documentation has saved our industry a lot of money and time and provided a lot of accuracy. On the process side, I believe that the integrations that FHIR and HL7 to Vinod, I think your point earlier around providing some kind of guidance, some kind of standards has been super helpful, right? And our customers are building not just large language models for research, but building small models that leverage these APIs and these capabilities to serve specific needs. So if they're doing a summarization of a patient record, they need a model that's effective, right? And that may not be a commercial model. So, I think to answer your question, I think an enterprise application that focuses on these needs that can, provide you some kind of accelerator, pre-built, pre-trained, pre-integrated start to your point around appointment management, right? That's a pretty simple use case today that a lot of folks have adopted. And that's a great start, but you need a platform that allow you to pick up tomorrow. Well, what are you going to do when your caregivers want to, seek information directly from the EMR, right? You need a platform, an enterprise approach, and a policy and a board that's going to approve your use of these capabilities. You can't just put together a bunch of parts. So I think these platforms, these enterprise AI platforms, are really going to help with the silos. We're going to be able to take a very different approach than we have in the past, where it's always been clinical decision support for this specialty. The next group get their own tools for clinical decision, and then the next group gets what's specific to them. Now they're able to build it on a single platform, whatever that platform is. There are several really strong platforms in the hyperscaler space as well.
Thank you, Gary. Vinod, I would actually like to open this up to you as well.
No, I think Gary made a very important point, right, about the platform and interoperability. See, I don't think there will be one platform that everybody uses. There will be many platforms. But I think the point is going to be there will be a platform nevertheless, right? Each entity is going to be focusing on that. And data is going to play a very big role. And thanks to the interoperability, I think the data has definitely become more streamlined. I'm not saying it's clean. It's much better because that is what is enabling AI to become a factor, right, in healthcare. Because 80% of AI is data. The other piece, right, is again, just to highlight the point that Gary made. See, gone are the days where your tools and technologies were based on your different functionality, right, or domains within the healthcare system, right, where you focus on oncology, you focus on diabetic care, cardiology, neurology, right? Now you have the patient journey in the center, and then you have all these supporting the patient, right? Whether it's administration, whether it's specific functionality, but everybody's looking at that journey and say, I'm coming here to help the patient in their journey rather than saying, patient is coming to me. That is a significant shift in the market today. And the tools are nicely enabling that shift as well. The last thing, right, is see the other important shift that has happened, right, especially during the past 5 years, is you don't have entities even in healthcare. Let's say provider, right, is a great example, or a pharmacy working in isolation, because there are many involved in it, right? You have primary care, you have secondary care, you have tertiary care, specialty, you have pharmacy, payer involved in it, which means the ecosystem is continuous, right? It's not one and done. In that space, the interoperability of data exchange and the tools integrating with each other becomes very critical. AI plays a very big role there because AI needs to be consistent, right? When you're doing that, because the data is everywhere. And AI needs to look at the data and then going back to the pattern and trend, be able to instrument that, right? So that is something that is still happening.
Thank you. Thank you so much. So let's transition to Garika. And also, I'm being mindful of our time as we're answering these questions. Let's kind of move through them a little bit more quickly because before you know it, it'll be at the top of the hour. So I just want to make sure that we're good on that. So next we have Garika. And the question I have for you is, how is AI enabling proactive patient engagement through chronic care management and medication adherence initiatives?
I think one of the most exciting things that we're seeing in AI healthcare is how it's enabling predictive engagement. which basically means like spotting different patterns early and helping us reach patients before they fall off track. So we're able to basically analyze things like refill gaps, condition history, as we spoke about before, and behavior patterns. So AI can really flag when someone needs that extra support and trigger the right kind of follow up for them, whether that's a message, an educational touch point, a real world example, or even a prompt to their pharmacist to send that prompt through in pharmacy education. So I think being able to drive this kind of proactive pharmacy-led engagement, especially for patients that are on multiple medications, managing their chronic conditions like diabetes, asthma. So they are supported not only at that point of care, but throughout every step of their health journey is something that's been, yeah.
Yes, I'm glad you brought that up. And education, I think, is very much key based to your previous point, Vinod, about trust. Again, even though we were talking about trust and technology, but educating the patient and throughout their journey, like you said, Garika, on every step, I think is very, very important and just elevates the whole experience overall and ultimately builds trust. Now, we'd love to bring you into the conversation, and I'm talking to you all as in the audience. If you have a question, I see that we have a couple that have come in, but if you have a question, whether it's about how AI is being used to improve patient engagement, the implementation process, or where the future of healthcare automation is heading, please drop it in the chat. Don't be shy. Again, this is a two-way street, and we'll be keeping an eye on your questions throughout the session, and we'll make sure to bring them to our panelists as we go, and we're looking forward to hearing your thoughts. Now, our next question is to both you, Vinod and Garika. What role is AI playing in expanding virtual care, telehealth, and telepharmacy services?
Gorika, why don't you go ahead? I'll chime in.
Yeah, sure. So I think obviously it's playing a really big role in making virtual care more scalable and personalized at the same time. It's helping with everything from remote consultations now to even automating follow-ups and providing smart medication advice. It's something that's already started. So care doesn't stop when someone leaves a clinic or a pharmacy. It continues to go throughout their entire day journey and integrated into their process and day to day. I think in pharmacy settings, especially, AI is helping us stay connected with patients beyond the counter through things like telehealth, remote counseling, and even like digital support through adherence programs and that sort of stuff. Even within our company, we're working on something really exciting called interactive medication assistant, which is going to be a virtual assistant that gives patient access to personalized medication information, their reminders, condition specific education, anytime they need it. So if a pharmacy closes at 5 p.m., the education advice that they need isn't closed. As Vinod mentioned earlier, if someone wants an advice on their medication at 8 p.m., they don't need to wait until 9 a.m. tomorrow to call their pharmacy and ask about it. They can just do it directly through that medication advisor. So this is, I think, a really big step forward in making pharmacy support continuous and not just when someone walks in or walks off that pharmacy.
Wow,
Yeah.
yeah, the medication advisor sounds exciting. So that's great that you guys are working on that. Vinod.
Yeah, I think the other point that I think the industry across, right, is looking at, see, if you look at things like telehealth, scheduling, even appointments, right, from that matter, I think if you think about it, there are three parts to it, right? One is there is a need for an individual to engage a healthcare provider or a professional. Second thing is there is an urgency, right, a time factor involved in it, and there is a component in terms of understanding the history, right, before an appointment happens. So these are the three pieces that make an interaction, whether it's virtual or in person. With telehealth, you cannot just do exactly what you do in an in-person interaction and just say it's going to happen virtually, because the if you think about the flow, when you go to the doctor's office, they ask you a lot of questions before you see a doctor, which means they're getting all that information before that happens. So the tools have to think about that, right, in a way where the virtual experience is similar to the in-person, but it's not the same. And how can AI get that information without having to ask, because it's already there? Because we all get frustrated if we are asked the same question multiple times. So it's no different, right, in the new world, where if the answer is already there, why are you asking the question for something that you already have? So we see that technology, right, like AI, is able to get that validated and then get the patient to confirm it rather than asking the question. So that's a shift that you will see in the market, specifically with the telehealth providers, where the data is powering telehealth, not the other way. And then the other piece, right, is when you are in the interaction, there are so many things coming at you, right, from a doctor's point of view or the patient, right, that the conversation is happening. Now, you don't want the individual, right, who's interacting with the patient to also take notes, type things when they're talking, right? Just like this webinar here. So you have technology like Scribe, right, that is actually listening and taking notes and populating the appropriate forms needed, and then allowing the doctor to focus on the patient care, especially in a virtual setting. It's extremely critical. Now, it's not just virtual, in person also, it's the same thing happening. But then in that conversation, right, if somebody says, okay, sure, I'll do a follow up, let's schedule it later, the system like AI today can also immediately say, these are your 4 options. Just click it. So that way the experience is seamless, right? So that's another thing that we see. Again, like we do at MedAdvisor using our interactive medication assistant, the same thing that Gary was talking about, right, in the setting. That's where the excitement comes with. I think you're not just adding tools into a bag of tools that's already there. You're adding something meaningful where it makes it easy for individuals to interact with healthcare.
Thank you so much, Vinod. Man, there's some questions I want to ask, but we got to continue with this conversation. But thank you so much for sharing what you said. Gary, how are healthcare providers and pharmacies ensuring compliance, data privacy, and ethical standards while implementing AI? And then Vinod, I'll move on to you with this because you even mentioned this before, but go ahead, Gary.
So let's really answer the question with respect to using AI, right? Because nothing that a healthcare provider has done in the past should not be applied to these new capabilities, right? We're always going to maintain HIPAA compliance. We're always going to maintain all of the privacy and security components. Now, does it get more complicated? Absolutely. And this is where an enterprise approach really helps a healthcare provider or a payer in that, they need to have the ability to leverage guardrails, right? They need to be able to really be able to scale from a generative answer to a out of the box straight answer. If you're asking me what the dosage is for a drug, I better be giving you that dosage right off the label. 100% do not use generative capabilities. Now, can I turn that in if it's a patient asking, can I turn that into a lower reading level than I would to a caregiver? Absolutely. But these are kind of the levers and the ability to use these new capabilities as a business person, not as a developer, right? Taking a no-code approach and giving a caregiver the ability to move these levers is super important. Obviously consent is very important from a patient facing. All of these things that we all grew up with, they're not going away. We've just added this governance layer that is really important as we transition from crawl, walk, run to leverage these capabilities. In the future, will it get easier? Absolutely. People will be more comfortable. We'll be leveraging it in precision medicine. We'll be doing a lot of genomics leveraging these capabilities. But listen, let's walk before we run. So
Most definitely. Thank you, Gary. Vinod,
Yeah, I'll just add to the point that Gary has already talked about, right? See, I think the most important thing is consent. The next thing right after that is making sure that in the absence of a single standard that everybody follows, what is happening with the patient data? And you can use HIPAA as a North Star or anything, but essentially you have to look at it to say, what's happening with the data? Who's got access to it? Is it serving the purpose of the care for the particular patient? And as long as it does that, I think it serves the need, right? I think that's what you have to look at any given time. And again, right, I think the technology is evolving very faster than how compliance standards and regulations are coming into play. So every entity has to ask the question, privacy first, patient safety first, and then look at how to solve for it, right? Because again, impact comes when you look at people first and then solutions, it's no different in the world of AI.
Yeah, I would want to caveat these responses that we just gave, because I agree with you completely, Vinod. And that is, we're talking about caregiver or patient facing. We're not talking about clinical decision support answers here, right? That's a very different answer, right? So I just want to be clear that there's a completely different approach to a clinical decision support tool, which we do, but it's a different approach to compliance and governance. Yeah.
Thank you, Gary. Yeah, thank you for that clarity. So the next question is to you, Garika and Gary. What challenges do healthcare and pharmacy teams face when integrating AI into patient-facing workflows? And actually, I think someone asked a similar question from the audience. So yes, this is a great question.
Yeah, I think according to me, one of the biggest challenges isn't the AI itself, it's how it's actually fitting into the existing workflows. I mean, a lot of the teams are used to doing things a certain way, and introducing new AI tools, even really helpful ones, can create resistance if they feel that they are disruptive to their day to day activities. I'd say, as an example, let's say a pharmacy chain rolls out an AI powered platform that flags patients who are overdue for a refill or vaccine, like we spoke about before. Technically, it's a really good tool. It uses real time data, sends alerts to the pharmacy team, but in practice, if those alerts aren't integrated directly into a pharmacist's workflow, like their dispensing system or a patient dashboard that they're already using, I think it just becomes, for them, another screen to check, something that might get missed or ignored when the store is like really busy. So even though AI is functioning correctly, it's not driving that intended impact because it hasn't been embedded in a way that feels natural and like efficient to use for them or in their day to day. That's why adoption often, I think, takes a backseat sometime, not because people resist that technology, but because it doesn't really support what they're doing in their day to day flow in a meaningful way. So I think one of the solutions is to co-design those AI tools with the teams that actually use them, so the tech feels like more of a support system, not an added burden to them. That being said, I also think it comes down to getting the stakeholder buy-in, managing change thoughtfully, and making sure that the cross-functional teams are aligned from the very beginning and not something that's just put upon them at a stage that this is done. Let's do it now.
Yeah.
Thank you so much,
Yeah.
Gary.
Yeah, 100% agree. And not unlike any technology, right? But I would also add that it's very important that we maintain a human in the loop here. And that is whether that's the patient or the caregiver or the administrator, we need to embed them in the process. First, of course, we have to train them on what these technologies are and teach them how to adopt them. But really, to the example earlier, where the low-hanging fruit I use with the automation of patient scheduling, right? Well, maybe a better place to start there is with the actual contact center agent and showing them how these capabilities can enhance their value to the organization versus replace the value, right? There is a lot of fear that these capabilities are going to replace humans, and I really believe that is not the case. They really will make them more effective and really will improve their, work-life balance, et cetera. So I think keeping a human in the loop on the patient caregiver side is very important. Of course, it's absolutely imperative that we keep the clinician in the loop, and we don't even imagine that we're going to provide a first opinion early on in the days of agentic capabilities, right? Again, we will simply be second opinions, tools that can be leveraged. Anyways, so from a challenge perspective, I also feel like a lot of caregivers do not know the capabilities exist. They do not know how to leverage them. Sure, they're moving into leveraging these capabilities to reply to letters from their, EMR from patients, right? That's great, but that's really super easy today. But they're not even aware of what is an agent, what is an agentic agent, how can I use it? And it's generational too, as you mentioned, Monique, right? Early on, some of us old folks like myself, it's a very different world, right? teaching a caregiver in a later stage in their career to leverage is a lot more difficult than someone who's using it at home every day. These tools. So there you go.
Thank you, Gary. Okay, we got 2 more questions, and I want to at least get some of these live questions from the audience. So Vinod, this next question is to you, my friend. What KPIs and metrics are critical to measuring AI success in healthcare and pharmacy settings?
Yeah, I think from a technology point of view, you have to look at the performance, you have to look at quality, and you definitely have to look at consistency. I think those are the things that you'll have to look at when you look at the KPIs. You have to select the tool. Is the tool doing the right outcome? Now, if you go beyond that, right, there are security aspects of it. So you'll have to look at the data and how the data is being addressed and stored and used, right? So that's another KPI, right? You have to make sure that it's HIPAA compliant. If the organization is using ISO 42001 framework, then it needs to be compliant with that. Are we or are we not? And then the last and most important thing, right, is see all the KPIs are to get to an outcome. Let's assume that the outcome is eventually a patient experience and then service, right? What is that, right? In some cases, it could be for the encounter. For some cases, it could be an ailment, right? Whether it's diabetes or it's cancer care. Did the person get the end outcome? Did they benefit from it? You got to figure out a way to track it. Today, unfortunately, I think we talked about it earlier. Given so many involvement, right? Everybody has got their own KPI, but often we forget about the patient as the center of this entire thing. So you got to look at it and say, did the patient get the benefit of the entire involvement? And if you do that and work backwards, I think we have a right way to continuously learn from it and improve, and then learn from it and improve and be transparent. Because going back to the trust point that you made, Monique, trust comes when you have transparency and awareness. You can do that both with KPI.
Yes, I love that. That was great, Vinod. Gary, I want to quickly open this up to you. Is there anything you would like to add?
Very simply, kind of summing up what he just said, right? Making sure you understand the intent of the patient. Do not frustrate the patient. The technologies will not, they will make your patient experience worse. If your tech is not able to identify the intent, to be empathetic as a machine can be, you might as well hang it up. So, there's a lot of metrics, right? But those are the most important ones.
Thank you. Thank you to you both. So our last question is to you, Garika and Gary. What emerging trends in AI, such as AI health coaching, smart triage, and precision medicine, are shaping the next wave of patient engagement?
Gary, do you want to start?
Sure. So real-time coaching is becoming especially in the mental health space. Trusting these capabilities, I think, is something that's going to evolve even more. In the clinical side, the imaging will continue, the analysis will continue to get stronger. For the patient side, doing these things, or for the caregiver side, doing these things in the background with agents, with agentic agents that are autonomous, that are intelligent enough to understand after this encounter. And I think, Vinod, you touched upon this. After this encounter, go do this, that, and the other without involving any humans, right? Until a human is necessary to review and approve. Those are the kinds of things we're going to see over the next year. Over the next 5 years, where we're going to get into some of these high performance agents, where agents are speaking to agents upon agents, and it's a whole infrastructure around these autonomous agents. But I think really enhancing the capabilities for the patient and for the caregiver is where we will continue to see over the next 5 years. This kind of real-time coaching, if you will.
Thank you, Gary. Garika, is there anything you'd like to add?
Yeah, absolutely agree with you, Gary. I think one of the really cool things that I think would also come in, and we're seeing a shift now, is already is around voice-enabled AI, and it's already being used in healthcare to make things more accessible and less burdensome on both patient and provider side. Especially on the patient side, I think we're starting to see voice-based medication reminders, refill requests, or even like symptom checkers that patient can interact with just by speaking. And I think that's going to be really powerful, specifically for older adults, baby boomers, or patients with like visual impairments who may struggle with apps or like text-based tools. So I think it's a great example of how AI can meet people where they are in a way that feels more human and intuitive to them. But I still think we're only scratching the surface now. Voice tech has still a lot of potential to reduce friction and bring care closer to the patient.
We have a real life use case I have to share. I'm sorry, I'll make it quick.
No, go ahead. Go
To
ahead.
your point, where we have a virtual assistant that the providers use, healthcare providers use, it dials out to the payers, to 500 payers. It navigates their IVR to get to something like claims adjudication. It waits on hold for 45 minutes. When an agent answers, it has a full conversation with the agent, collecting the adjudication information, brings it back, and writes it to the EMR
Yeah.
completely with it, right? So
Mm.
it's that you're absolutely
Mhm.
right. The voice, the
Yes,
voice is just where it's all been for us for the last couple of years. Yeah.
most definitely. Oh, wow. Amazing, amazing stuff. Well, we covered a lot. And then there's some questions I wanted to get in there, but off the top of my head, but for the sake of time, um, we're going to switch quickly to maybe one or two questions. And I asked for each of you on the panel if we could do a rapid fire, like it's a one sentence type of thing, as
Sure.
much as possible, I would greatly appreciate that. So a lot of the questions, quite frankly, is on the integration side, like from a beginner level, especially with organizations who are looking to integrate with or include AI. um, Here's one question: how important is AI literacy among healthcare staff, and what training or upskilling initiatives do you recommend for organizations beginning their AI journey? Who would like to
So
go first?
important. So important. There's an organization called AI Med that focuses on clinical education. Highly recommend you take a look at their courses. It's run by Dr. Chang out of Children's Hospital of Orange County.
All right. Vinod or Garika, anything to add? Or we can move to the
I think
next.
for teams just starting out, I'd say beginning with simple role specific training, showing, for example, how an AI powered system can help in a marketing side or an operations side or in product side, specifically different tools for different roles.
Mhm.
Coming from up top would be a really good way to just get started. And then really recognizing those AI champions within the company to then spread it across and help others do the same is something that people could start with.
Thank you. So one more question, last question. How do you approach deciding which AI use cases to prioritize first in a healthcare environment?
Yeah, I think it's a very easy question, right? Because the way you look at use case prioritization, right, is to look at what can you do in a way where you develop proof point to get to the outcome. And usually the administrative workloads are the best one to do because these are repeat tasks, rules based. It's been going on for a long time. It's easy for AI to come and help do that. That helps in two ways, right? One, it builds confidence within the organization. It enables the organization to have proof points to show that there is value. It automatically improves efficiency, enables the healthcare team to focus on the patient, right? So you need that, especially when you're driving a cultural change in using technology. So I would definitely recommend taking that approach.
Thank you,
Yeah.
Vinod. Wow, wow, wow. What a great conversation. Thank you all so much for being here. So, to you, Garika, you, Vinod, you, Gary, and to you, the audience, for being here and being a part of it. We've covered a lot of ground, from how AI is improving patient engagement to how it's helping providers And pharmacies create care experiences that are more personalized, proactive, and connected. And I think our key theme word here is trust, creating trust, right? Thanks to Vinod for saying that. This event's recording will be available on the same LinkedIn live event page for those who missed it or wish to revisit these discussions. Again, my name is Monique. I'm here on behalf of Pronix Inc., and I just want to say how proud we are to support healthcare organizations as they bring these kinds of innovations to life, whether it's streamlining workflows, improving outcomes, or just making care feel more seamless. We're here for it, and we're here to help. Thank you again for joining us, and we hope to keep this conversation going as we all work together to shape the future of healthcare. Thank you again, Garika, Gary, and Vinod.
Thank
Thank
you.
you for having us.
Thank you, Monique. Thank you, Monique. It was a pleasure.
Yes, it was definitely a pleasure.